Hi, my name is Nicolette Bagoli and I'm a patient navigator. Patient navigation can be defined as someone that removes barriers to care and coordinates the care a patient will receive. Navigators focus on making sure the care a patient receives in the hospital is individualized and that they are getting their care at an appropriate time. Other things they help patients with is things like scheduling a follow-up appointments, getting the right health tests done, and providing emotional and psychosocial support to the patient and their family. Something that has been a problem and is continuing to be a problem is alcohol abuse. Not only in the United States, but worldwide, alcohol consumption is becoming more and more, which can lead to an alcohol dependence. In the United States alone, 82.4 million people are considered heavy or binge drinkers, and 15.1 million people are diagnosed with alcoholism. The true cause of alcoholism is unknown. However, some researchers believe that when a person begins to drink often, it causes a chemical change in the brain which can cause the desire to continue to drink for that feeling of pleasure even more prominent. Eventually, however, that feeling of pleasure disappears and a person will continue to drink to avoid experiencing withdrawal symptoms. Withdrawal symptoms include things like nausea, shakiness, anxiety, and hallucinations. Other factors that might cause alcoholism are things like how frequently a person drinks, when that person began drinking, and if there's a family history of alcoholism. How often and how much a person drinks depends on how much of a desire they have for the alcohol. This desire increases over time as they begin to consume more and more. This also varies from person to person because everyone's body handles alcohol differently. How long someone remains an alcoholic depends on when they are ready to get treatment or when someone else brings their problem to their attention. Some people may never seek help, while others would be more than willing to get the help they need. Alcoholism can cause over 200 different types of health issues and is the leading cause of deaths worldwide. Some issues alcohol consumption can cause are things like cardiovascular disease, diabetes, both intentional and unintentional injuries, gastrointestinal disease, and a variety of other cancers. For young people, some health issues might include unprotected sex, drug use, and iron deficiency. People deserve to know how consuming alcohol affects their body and if it gets out of hand, how to fix it. As a patient navigator, there are many interventions I can provide to help prevent or treat alcoholism. If a patient has a history of heavy drinking, I can inform them of different ways to prevent the development of an alcohol dependency. As preventative measures, I can do the brief interventions. I can use this in two different ways. The first way is to bring awareness to the person. This can be done by providing feedback based on screening results that are done by testing. The second way is providing specific techniques that I believe will work for that particular patient. Both involve steps to take in order to reduce or prevent the development of alcoholism. As a patient navigator in this type of situation, motivational interviewing will be very useful. This technique helps patients solve why they are drinking more than usual and what is preventing them to stop. It encourages patients to use their own abilities to help stop or prevent overdrinking from occurring. It also allows patients to have follow-up appointments to make sure they are continuing down the right path. For a younger generation, I can use things like technology and educational classes, which can begin in early education to teach the dangers of drinking and what can happen if addictive behavior begins. If someone has developed an alcohol dependency already, I can recommend things like psychological therapy. There are two main types used in this situation. Cognitive behavioral therapy, which looks at everything going on in a patient's life and not just the alcohol abuse. This can help prevent relapse because it recognizes all the things a patient is struggling with and not just the alcohol dependency. The other form of therapy is Alcohol Anonymous. This is a 12-step program that believes abstinence is seen as the only way of treatment. Pharmacological therapy uses medicine to help people with an alcohol dependence. It can be used on its own or with psychological therapy. These therapies will help patients stop drinking or reduce the amount of alcohol consumed. As a patient navigator, I will have a list to recommend to my patients that will help them with their alcohol addiction. Okay, so now for the debriefing. Did I represent myself professionally and in the role of a patient navigator? I believe I represented myself professionally and in the role of a patient navigator just because I'm aware of all the different therapies and treatments possible for a patient that's suffering from alcoholism, and I feel like I'd be able to help them with the issue and provide them with a list of things that they can do to help with that. Did I successfully make a case that change is needed and possible? I believe that I made the case that change is needed just for the fact that there's over 200 health issues that alcoholism can cause, and that it's also up pretty high on the list of what can cause death. And I think that change is possible because there's so many different interventions already available for patients. They just need to be aware of them. Did I sufficiently explain the cause of the problem? I believe I did, and that just depends on the person and what they believe caused them to start drinking. And it could be something psychologically or genetically because they believe that family history has a lot to do with alcoholism as well. Did I discuss the FIDO and impact factors adequately? I believe so. Impact factors depend a lot on the person again, and how often and how long they drink for is all depending on when they are willing to get help or if someone is willing to support them in getting that help and how long it lasts for. It just all those factors depend on the person. Was my solution practical and likely to be adopted/adapted by the proposed stakeholder? I think all of my solutions were very practical. There are different types of behavior and medicines that can be used, but there's also solutions that a person can do on their own and they don't need to be in a hospital setting for. What did I do best? I believe that I was able to explain different treatment plans for patients that I can provide as a patient navigator to help them overcome their alcohol abuse. And what can I do better in the future? I believe that I could probably explain different things when it comes to like why they're dependent. I feel like there's more to it, but there was just a little bit that I found tonight, and I think I could have done better on that.